In the governor's budget, there is a proposal to take $187 million out of the indigent care pool. This is the money that's used to support the coverage of uninsured. There is simultaneously an attempt to take $300 million away from the Health and Hospital Corporation in New York City that serves enormous amounts of uninsured and Medicaid patients. And what the government, the administration has told the public hospital system is, well, of the $300 million we're cutting you, we'll give you 110 back, but only if the voluntaries lose the $187 million. This blatant attempt to have public hospitals around the state turn on the voluntaries, or to have the voluntaries turn on the public hospitals, is as despicable as anything else you've read about in the newspapers over the last 3 weeks about the behavior here. And that's on policy. Despicable. You see, it doesn't, we have so much more in common across this state than we have that is different. But that's not what they want you to think. So every issue is cast as public against voluntary, teaching against non-teaching, upstate against downstate. Where is the morality in a proposal like that? Where is even the vaguest notion of connecting to policy during a time of a recession? Right in Manhattan, St. Vincent's Hospital is on the brink of its second bankruptcy or closure or collapse or takeover, and they're scrambling to find $6, $7, $8 million a month to keep it going and meet payroll till they figure out what to do with it. And while we make that effort up in Albany, we're passing a budget that is going to create 6 or 10 or 15 more St. Vincent's all over New York State. That makes a heck of a lot of sense.
The legislature must protect health care jobs and services by rejecting the governor's health care taxes and cuts. We have already sacrificed far more than our share. Very calculated and specific elements were included in the governor's initial budget and his 21-day amendments that were designed to elicit a very calculated and specific response. They seek to divide and conquer us. We must resist succumbing to this strategy.
And truly, we are here on a very important mission to oppose Governor Patterson's disastrous budget that contains significant health care cuts and taxes. Healthcare has been through 6 different budget actions over the last 2 years, and this latest round would truly be devastating, not only for providers, but more importantly, for the communities they serve. Hospitals are the anchors and the economic engines in many of our communities. Hospitals, trustees, and legislators share a common goal: to protect and improve the quality of life for all New Yorkers. You folks are out in the community. Ask people to visit helpyourhospital.org and helpyournursinghome.org.
Another round of cuts in Medicaid to hospitals and nursing homes and home care and community health centers and pharmacy and everything else, coming after, I guess, about 20 years of package of cuts after package of cuts, is really not something that New York could in good conscience enact.
But what I can assure you is that through the entire negotiation process, through our conference committees, and through an adopted budget, the issues of healthcare, the healthcare community, what you and your organizations represent, both from the past and as we look forward to the future, we recognize that we have to stay solvent in the present. And that's going to be our goal, that's our mission, and that's our purpose.
We need to step back in regard to health care, and what are we asking you to deliver? How are we asking you to deliver this? How possibly do you exist if these numbers are as stark as they are? And there needs to be these substantive discussions.
Talk to any of your partners in the Assembly majority, and you'll find that we share a common belief that access to appropriate, affordable A1 health care should be the right of each and every New Yorker and the moral obligation of this state to deliver that. Let me assure you, we continue to be committed to the idea of shared sacrifices. All that I can ask of you today as you head out to meet with your legislators, urge them to set the politics aside and to focus on the financial challenge in front of all of us.
Last year certainly was not a good year for healthcare, as I don't think the last several years have been good for healthcare. And the business in New York right now is in need of serious overhaul. If the FMAP funding does become available, it should go directly and entirely to healthcare.
And I'm hopeful that for every dollar that we can save on wasteful government spending, we can reinvest that in healthcare.
We want people living in our communities who care about healthcare and are going to advance healthcare, and we want to make sure that we fund that in the way that we should. I mean, it's key. The economic growth of New York State is tied to the healthcare, the availability, the accessibility, and the quality of the healthcare that we provide.